At our practice, we are regularly hearing from people who are struggling with anxiety, panic symptoms, or overwhelming life stress. If you're someone who struggles with anxiety, you may have tried talk therapy or learning coping skills such as breathing techniques or taking medication, but you probably still feel stuck. One approach that can be particularly helpful is EMDR therapy for anxiety. EMDR is a structured, research-based treatment that helps people process distressing experiences that may still be triggering anxiety in the present. While EMDR is often associated with trauma treatment, many people are surprised to learn that it can also be highly effective for anxiety. EMDR stands for eye movement desensitization and reprocessing. It's a type of therapy originally designed to help people heal from trauma and distressing memories. When someone experiences an overwhelming event, the brain may not be able to fully process the memory, and instead of being stored as something that happened in the past, the memory can continue to trigger emotional and physical reactions in the present. EMDR utilizes bilateral stimulation, such as eye movements, tapping, auditory tones, to help the brain reprocess experiences that have become stuck. EMDR therapy can be especially helpful for people whose anxiety symptoms are connected to past experiences or trauma. Stressful or overwhelming experiences that are not fully processed, especially in the early childhood years, can result in impaired coping skills and make people more sensitive to stress later in life. This can lead to the development of and continuation of such problems as anxiety disorders. The belief is that EMDR processing of disturbing memories that are related to the anxiety will reduce or eliminate the emotional, somatic, which are body-based symptoms, cognitive, and behavioral symptoms of anxiety. People with anxiety often have a history of past distressing life events, attachment wounds, relationship trauma, chronic stress, or early childhood experiences of unpredictability or fear. When someone experiences early distressing events, the nervous system senses a threat and activates the body's fight or flight response. After a threatening experience, the nervous system can stay on alert, even after the danger has passed. This can happen for many years. When the brain hasn't adequately processed a stressful event, it will keep reacting as if the danger is still present. EMDR has a three-pronged approach: working on the past, looking at such things as the first or earliest experience that contributed to anxiety, or the worst experience contributing to anxiety, or it looks at the present, which working on the present is looking at the present triggers or recent experiences of anxiety. And when you work on present triggers, it decreases the fear response elicited by the anxiety. And finally, working on the future. What future situations might be creating anxiety or fear? And when we process those feared future situations with the EMDR, it can lead to a decreased anxiety and fear response. EMDR helps with anxiety by identifying root experiences, reprocessing distressing memories, reducing nervous system reactivity, and building adaptive beliefs. Using the EMDR protocol helps to understand how past, stressful, or traumatic experiences may be connected to the current anxiety. During EMDR therapy, we uncover negative beliefs resulting from that disturbing event, such as "I'm not safe" or "I'm not in control," and these negative beliefs become core themes underlying the current anxiety. It's important to identify these past root causes of anxiety. We also work on reprocessing distressing memories, and so during those reprocessing of those disturbing events associated with the development of the anxiety originally, the brain is able then to process and file away those old memories. And the emotional intensity connected to those events often decreases. And also, we see with EMDR therapy that we can reduce nervous system reactivity. So EMDR therapy and other somatic strategies help the brain and the nervous system recognize that the threat is no longer present. And as a result, clients can experience fewer panic spikes, reduce reactivity to triggers, and increased emotional regulation. During EMDR, negative core beliefs are replaced with more adaptive beliefs, such as changing "I'm powerless" to "I can handle this." EMDR helps with different types of anxiety, such as generalized anxiety, panic disorder, social anxiety, performance anxiety, such as test anxiety or sports anxiety, phobias, and anxiety connected to trauma. EMDR can be an effective treatment for anxiety, particularly when anxiety is connected to past distressing experiences. By helping the brain reprocess these experiences, EMDR may reduce emotional intensity, triggers, and physical anxiety responses. Many people find that their anxiety symptoms decrease as their nervous system learns that past events are no longer a present threat. EMDR therapy for anxiety typically begins with an assessment phase where you and your therapist will identify the concerns you want to work on and build coping resources to help you feel grounded. Once you feel prepared, the therapist will guide you through processing specific memories or experiences connected to your anxiety using the bilateral stimulation. For the most effective treatment of anxiety, therapists may also use additional approaches alongside EMDR, such as CBT, interoceptive therapy, and exposure therapy. They are all effective adjuncts to EMDR. Many clients find that as these memories are reprocessed, the emotional intensity decreases and anxiety triggers become easier to manage. The pace of EMDR therapy will be tailored to your comfort and needs. The length of EMDR therapy varies depending on the individual and the complexity of the experiences being processed. It also depends on whether other therapies such as CBT, interoceptive, or exposure therapies are needed to help decrease anxiety in addition to the EMDR. Some people notice improvements in anxiety symptoms within a few sessions, while others may benefit from a longer course of treatment. If you're struggling with anxiety, you may have already tried different strategies such as talking through your worries, learning coping skills, or practicing relaxation techniques. EMDR therapy may be worth considering if your anxiety feels connected to past experiences, or if coping skills help but haven't fully resolved your symptoms, or if your reactions feel stronger than the situation seems to warrant. If you're interested in learning whether EMDR could help with your anxiety, contact us to schedule a consultation. We're here to help.